absolute game changer. Yeah. Absolute game changer.
The barriers to some of Sydney's eastern suburbs beaches came down this morning.
I think it's the best decision they've ever made.
The decision came with some harsh directives that Coogee, Clovelly and Maroubra are only open for exercise.
I'm watching the people going into the water, they're getting up, covering up with the towels, going home. It's good to see.
But not everybody followed the rules.
Enter and exit at the entry point at the beach.
It comes down to personal responsibility. If you want those things to stay open, please do the right thing and they will stay open.
The state's infection rate continues to fall with just 6 new cases. 2 of those are connected to Newmarch House. That takes the total to 41 at the aged care home in Western Sydney.
It's a cautionary tale for anyone working in aged care or with vulnerable people, how, again, I can't stress it enough, the minest of symptoms, please do not attend work.
And it's prompted a call for workers in aged care, disability services, boarding schools, prisons and detention centres to get tested if they have any symptoms.
The implications of you introducing COVID into those institutional settings can be quite significant because we are aware that in those settings we see quite an amplification and spread of COVID-19.
The government has been trying to increase testing and it seems to be succeeding. Almost 4,000 more people were tested in the past week compared to the previous one. It's also continuing its strategy of targeting specific areas where the source of a number of cases is unexplained. Those council areas that remain a concern are in Sydney's western suburbs, Ryde, the inner west and the east. This week, Canada Bay and the Goulburn area have also been added, along with more clinics to encourage anyone sick in those areas to get tested. Ashley Raper, ABC News, Sydney.
The very low number of new cases is giving everyone real hope. Australia is winning the fight against coronavirus, but as Casey Briggs explains, it isn't just the lack of new infections. Other key indicators are heading in the right direction too.
We've seen a remarkable drop in new coronavirus cases today, the kinds of numbers we haven't seen since early March. 4 states and territories today recorded 0 new coronavirus cases. We've had just 8 across the country. Tasmania is yet to report its figures for today. It had 7 cases yesterday. There were also 19 new Ruby Princess crew members diagnosed with coronavirus today, but because they're still on board the ship, they don't count in Australia's national figures. Good news too on the testing front. As the infection rate's going down, the testing rate's actually up on where it was last week. And the number of serious COVID-19 cases is also trending downwards. As of this afternoon, 170 people were being treated in Australian hospitals. Small numbers of cases means that contact tracing becomes an easier job, and the Australian government's basing its contact tracing app on Singapore's. That's a country that had won early praise for its early response in tackling this outbreak. But Singapore now has a problem. Rapid spread in cases, almost 1,500 of them recorded today. The spread is largely being driven through crowded dormitories of foreign workers, and that's a hard place to do contact tracing. Around the world, we've now seeing more than 5,000 deaths recorded every day. The total death toll stands at 165,000.
Economists are warning younger Australians and women are likely to be the hardest hit by the shutdown because they're more likely to work in close physical proximity to others. The Grattan Institute believes the unemployment rate could reach beyond 25% as a result of COVID-19, the highest rate since the 1930s. The Reserve Bank has acknowledged the magnitude of the impact on the economy, but says the shutdown and the government bailout are necessary.
Aaron Smythe was meant to be performing in Billy Elliot the Musical in Melbourne, but the season was cut short, so now he's at home on the Gold Coast.
It's just like, it was real, and she's like, and clean out your dressing rooms tonight. Like, you won't be returning on Wednesday.
The show was performing to up to 2,000 people a night, with a cast of 45, not to mention musicians, crew, ushers. All those jobs are gone.
A lot of artists, we kind of know what this feels like, but it is more real than ever because everyone's going through it.
The Grattan Institute has crunched the numbers on the jobs affected by physical distancing rules and found as many as 26% of Australian workers lost their job.
That leads to an unemployment rate of somewhere between 10 and 15%, which would be certainly the worst recession that we've had since the 1990s and probably since the 1930s.
Not surprisingly, the biggest job losses are in hospitality, the arts and tourism, and lower income workers are hit much harder.
Lower income earners are twice as likely to be affected by the crisis as higher income workers because they tend to work in the kind of occupations and industries that require close physical contact, and therefore they're more likely to be out of work at the moment as a result of the COVID-19 crisis.
The report also found young people are disproportionately affected, with 40% of teenage workers likely to lose their jobs. The report only looked at direct job losses from physical distancing, jobs that require people to be close to each other. But once industries like the arts are allowed to reopen, there are warnings of more job cuts as people and businesses scale back on spending.
No one can be sure how long the restrictions and shutdowns are going to stay in place. I think we need to know how long they're going to stay in place before we can say exactly how sharp the economic contraction is going to be. But it will be sharp.
A dizzying prospect. Margaret Paul, ABC News, Melbourne.
Patients are pushing for the ban on elective surgery to be lifted when National Cabinet meets tomorrow. All non-urgent operations were cancelled a month ago to keep hospital beds free for an expected rush of coronavirus patients. But the AMA says resuming any elective surgery should be done in stages.
Penny Hamilton-Smith has osteoarthritis and is looking forward to getting a hip replacement.
As the days go on, of course, the pain increases. It doesn't get better, it gets worse.
All but the most urgent surgery has been on hold for the past month. IVF and breast cancer screenings have also been suspended. But patient advocacy groups believe it's time to start easing the restrictions.
There's a lot of vacant beds in private hospitals at present. There's a lot of surgeons that are idle. And there's a backlog of patients sometimes in severe pain.
The AMA is urging caution and says the ban should only be lifted when the time is right.
The time is definitely not right now.
The government says pressure on hospitals has been less severe than predicted.
So I am hopeful that during the course of this week, the medical expert panel and the National Cabinet will be in a position to make decisions and to give guidance for the future.
He says there are now sufficient supplies of protective kit to consider resuming elective surgery, but those on the ground disagree.
The distribution and supply of personal protective equipment, which at this stage still remains quite stretched in many areas, with patchy supplies all around the system.
The AMA says rather than a blanket lifting of restrictions, it might be wiser to allow elective surgeries to restart in some regions before others. And he says less risky operations like joint replacements could be prioritised ahead of more complex procedures. Scott Gibbons is a surf lifesaver at Bondi Beach. He needs surgery on a ligament in his right thumb that was torn during a rescue.
I don't want to put myself forward unnecessarily, but at the same time I don't want to have to wait multiple months for the sake of being overly cautious.
It now looks as if he won't have to wait much longer. Alison Shao, ABC News.
It's been revealed the government hasn't run national pandemic exercises for more than a decade. The exercises are designed to test how well Australia can respond to a viral outbreak such as COVID-19. Pandemic planners say stopping the exercises may have affected how well prepared Australia has been. Dylan Welch from ABC Investigations reports.
You'll be asked to carefully wash your hands using the solution provided.
This might look like footage captured today, but it's from 2006. This was a national drill designed to test Australia's response to a viral pandemic. Another exercise was held 2 years later. None have been held since.
Unfortunately, what we've seen happen since 2008 has been a series of events which have contributed to those pandemic plans going on the back burner.
Well, I do still plan to go to the football on Saturdays.
The pandemic planners told ABC News that early communications failures, such as those remarks by the Prime Minister and the Ruby Princess debacle, could have been avoided had exercises continued.
The fact that there was an element of confusion as to who may have had responsibility for making the final decision, I think sort of points to the lack of preparedness.
Rex Patrick is a member of the Senate committee looking at Australia's COVID-19 response. He says the absence of exercises should be investigated.
We need to understand whether or not proper priority was given to these exercises.
The government defended its preparedness, pointing to Australia's relatively small number of COVID-19 infections and deaths.
I think that preparation that we've done over the last 20 years, including recently, has been very important in our way of being able to cope with this very difficult and, in many ways, unprecedented situation.
He says the government's response has been well planned. Dylan Welch, ABC News.
Facebook and Google will soon have to pay for news content sourced from Australian media companies. The government has tasked the competition watchdog with designing a mandatory code of conduct to counter the way technology companies generate advertising revenue from journalism created by others. Political editor Andrew Probyn explains.
For more than a century, the Barrier Daily Truth's been Broken Hill's chronicler.
It's been a battle to keep your head above water.
With advertisers increasingly going online, it's been harder to make a profit printing news.
A lot of people tend to just want to advertise for nothing.
Then coronavirus hit, restrictions shutting down local businesses.
First thing they did was pull their advertising, which was our lifeblood.
As a result, the print runs now weekly, with staff to be paid under the government's JobKeeper program.
We all just want to see the paper survive and want to see our jobs survive.
Journalism isn't cheap, but stopping news being cannibalised by online behemoths is now the hot scoop.
It's time the tech titans were held to account.
A mandatory code of conduct's coming to force the likes of Google and Facebook to pay for news content they pilfer from Australian media outlets.
We believe this is a battle worth fighting.
It's a welcome step. It will address some of the issues in digital disruption.
But enforcing it will be hard. No other countries managed to do it. So many of us show blind trust in Facebook and Google, surrendering valuable personal information to multi-billion-dollar foreign companies. Contrast that with the instinctive resistance some are showing for a government-sponsored coronavirus tracing app designed to help health authorities track down people who've come in contact with a COVID-19 case.
We think that Australians will come with us on this. They will see the inherent value in having a mechanism that helps those disease detectives do their work.
And of course, when the pandemic's done, you just delete the app and all the data disappears.
The greater the take-up, the sooner, we're told, that'll happen. Andrew Probyn, ABC News, Canberra.
China's government